Dr. Jennifer Caudle. She's a family physician, associate professor at Rowan University's Department of Family Medicine. Dr. Caudle, always good to have you with us. Thank you for being here. I wanted to ask you, as we get started with this, what your main takeaway is from the numbers that we're seeing, the rising number of cases, yet the number of people who are dying is not rising. What is your takeaway from that, those new statistics that have come in?
Right. So the rising number of cases tells me, just like it tells all of us, that we are not done with this yet. We are still very much in the throes of this pandemic, and it's prudent for us not to be naive, especially as we go into this holiday weekend. The deaths, we know that deaths can lag behind by a couple of weeks. So what I'd really like to see is in the next couple of weeks how those numbers shift, if at all, because if anything, we see deaths lagging behind the actual cases.
Doctor, I wanted to bring in the Surgeon General because, what he has to say obviously influences many Americans when it comes to their health. Listen to his comments just before the holiday.
It's not a yes or no. Every single person has to make up their own mind. There are going to be people going to beaches, going to barbecues, going to different environments, and they have to look at their individual risk. As you mentioned, CDC says larger gatherings are a higher risk. You have to take that into account.
What are your thoughts on that, Doctor? Is it an individual decision, or do we have a national kind of responsibility?
Yeah, so it's so interesting that you play that clip, because I actually tweeted the Surgeon General yesterday after I saw that clip, and I tweeted directly to him, publicly that with all due respect, I would have said to avoid large gatherings, and I literally put that in a tweet because I feel that way. I mean, yes, the bottom line is it an individual decision? Of course it is. No one can literally make you stay home at this point. They can't handcuff you and keep you in your house if you choose to leave. And also, yes, as you mentioned, we do have a responsibility not only to ourselves, but to the country and to other people. But the bottom line is, in the middle of this pandemic, we're seeing cases that are rising in Texas, Arizona, Florida, other places. We know we are far from done with this. The CDC has recommended against large gatherings. It's prudent, I think, for medical physicians, healthcare workers, and the rest of us to say, hey, look, you do have a choice, but you should stay home and avoid large gatherings. So I actually tweeted that out yesterday, that I actually say avoid large gatherings. That's what needs to be done at this point.
I want to ask you, too, about this new report that there's been a mutation, and that mutation shows that the virus is more infectious, but it's no more virulent. It's not going to necessarily cause more deaths based on what they found. It sounds like good news on the surface to some degree. More people might get sick, but they may not. More people might not die. Help us understand: is this or is this not less dangerous?
So that's a really good question. I think time is really going to tell us really how we can think about this mutation. But let's put mutations in perspective. Viruses mutate. That's actually one of the things they just do. It's not entirely surprising that we've come across a mutation with this virus. And you're right, this particular mutation seems to be that it's more infectious, meaning that it can spread easier, faster, quicker, more readily, but is not necessarily more virulent, which means it's not necessarily any more deadly than what we have seen, which in that respect is good news, right? It's good news that it's not more deadly, or that it doesn't seem to be. I think that time is going to tell. Coronavirus and COVID, this is a very new condition, a new virus for us. It's a new disease state. Every single day we're learning more and more. So, to be honest with you, I think the verdict is still out about how this is going to play into our total landscape of infections and cases and things like that. But at least at this point, it doesn't seem to be more virulent, which that is a good thing.
What do you make, Doctor, of the age of those who are impacted going down? It's gone down significantly from those that we saw, with elderly patients to now very young. Is that a change of the disease, or is that a change of practices by people?
That's a really good question. Once again, I can't say for sure because, there's likely multiple factors playing a role here. And when we get months away from this, I think we'll have a better idea of what's going on. But the thought seems to be, and I have to say I agree with this, that, we are seeing younger people having this condition, and it may be due in part, at least, to changes in behavior. Younger people maybe being more willing or more readily going out, the beaches, the clubs, the bars, etc. The swimming pools, the Memorial Day events, and things of that nature. Look, I've said this before, and I'll say this again. Young people are not necessarily immune. We know that young people can get the disease. I think that there's this myth or this feeling that, oh, if I get it and I'm a young person, it won't be so bad. I'll be just fine. Well, the truth of the matter is that, yes, complications tend to be lower and less in younger people, but they're not necessarily benign. I've said this before. I've had patients and have known people that have gotten COVID that are young and healthy, that have had strokes, that have had loss of sense of taste and smell that have lasted for weeks and weeks. The fatigue, the shortness of breath, even after they've recovered technically from COVID, they've still remained symptomatic. So I don't want any young person or anyone out there for that matter thinking, oh, if I get it, it's going to be a walk in the park. We hope it will be, and likely for young people, it will be. But it's not necessarily like that for everyone. And of course, we know young people, just as other people, can spread it to those who are higher risk. So we need to stop sort of thinking that this is not such a big deal, because we know it can be, and we really got to take that into consideration.
A great point. Dr. Jennifer Caudle, thank you very much for joining us. Great to have you on the program today.
Thank you so much,
Thank
Doctor.
you.